All right, Troy?
Yep.
Hi. My name's Ryan. I'm a student doctor of physical therapy with NAU. Is it all right if I come over and work with you today?
Yep.
All right. So I saw that you pretty recently had a coronary artery bypass graft. How'd that operation go, and how have you been feeling ever since then?
It went pretty well. I feel a little bit tired, but feeling better than when I went in.
Yeah, I'm glad to hear that. So if it's all right with you, what I'd like to do with you today is just perform a couple of tests to assess your cardiovascular and pulmonary systems. Is that all right with you?
Yep.
All right, so the first thing we're gonna do is I'll use my stethoscope to kind of listen to your lung sounds while you're breathing. And in order for me to do that, it'll work best if there's no clothing between the stethoscope and your skin. So is it all right if you take off your shirt while I perform this on you?
Yep.
Right. And what this will entail is I'll just place my stethoscope on a couple different spots on your chest and your back. You just breathe in and breathe out. Any questions?
Nope.
Start off kind of right above your collarbones. And breathe in. And out. Breathe in. And breathe out. Down a little lower into your rib cage. Breathe in. For this next one, I kind of need to get up under your arm a little bit, so go ahead and put your arm up for me. And breathe in. And same thing on the other side. Go ahead and breathe in. All right. Go ahead and face the other way from me so I can assess some of the sounds in your back now. Now, breathe in. And same thing on this side. Down a little lower now. Go ahead and all done with that, go ahead and turn back around. All right. So I didn't hear any adventitious or abnormal sounds in your breathing, so we'll continue on with this assessment. So for the next part of this assessment, I'm going to assess how well your chest wall and your rib cage expands when you breathe. So what that'll entail is me placing my thumbs in between just below the top of your sternum, just below the bottom of your rib cage, and halfway between the bottom of your rib cage and your belly button, having you inhale, and I'll see how kind of far my hands expand on your rib cage. Is that all right with you?
Yep.
All right. Go ahead and lay down. Right. So we'll start out with just me placing my hands kind of right on the top of your sternum. Is that all right with you?
Yep.
All right. Right here. So go ahead and take a deep breath in. All right, that looked like about 3 centimeters, which is what I would want to see. So I'll move on to the next component, kind of right at the bottom of your rib cage, right here. Go ahead and breathe in again. All right, that looked like about 5 centimeters, which is what I want, so we'll continue. Last part of it, right in between your bottom of the rib cage and your belly button. Go ahead and breathe in one last time. That was more like 6 centimeters, which once again, what we want to see. So we'll continue on with this. For the next component of this exam, I'll be assessing your peripheral circulation. And how I'll do that is just, I first see if I can feel the pulse on the top of your foot. And if I can, and it's normal, I'll assess the blood pressure of that artery compared to that of your arm. Any questions?
Nope.
Is that all right with you?
Yep.
All right, let's get started. If you don't mind, go ahead and take off your shoe. Is it all right if I put my hand on your assess your pulse? All right, go ahead and flex your toe up. Good and relax. Go pulse right here. It's pretty normal quality. It's not exaggerated or anything, so we'll continue on with this assessment. So for the next part of this, taking your blood pressure, is it all right if I wrap this blood pressure cuff around your calf?
Mm-hmm.
And then I'll inflate that up to about 30 millimeters above what your blood pressure typically is. So what's your regular blood pressure?
Usually around 120.
All right, I'll inflate it up to around 150 then. So I got that at about 116 over 74. It's a normal level. We'll see how it compares to your arm. So we get this off real quick. And once again, is it all right if I put this around your arm to assess your blood pressure? Let me see if I can feel your pulse in your arm right quick too. All right, feel the rise out here. And then that time I got 116 over 72 for your blood pressure. So that means that your ankle brachial index, or just how your blood pressure in your foot compares to that in your arm, is at an exact ratio of 1, which is the normal volume. So we'll continue on with their assessment as well. Cool. Any questions? And for the last component of this assessment, I'm just gonna assess how any potential exercise or activity affects or causes any pain or pressure in your chest or anywhere in your upper body. So what I have right here is the angina scale. It kind of gives you what each rating is, kind of 1 through 4, going from like mild symptoms at 1 all the way up to very severe at 4, as you can see there. So what I want you to do, at a pretty good pace, cross your hands over your chest and then just stand up and sit down 10 times. And then after a couple of minutes sitting down, tell me kind of at which one of these numbers you're at right here. Any questions? Nope. All right, so just cross your hands over your chest. Get started whenever you're ready. Couple seconds, deep breaths. And then what number on that scale do you think you are right now?
Probably about a 1.
All right, so pretty mild, not too much discomfort or anything?
Nope.
All right, well that will conclude our assessment right here. Any other information that you think I should know, or any other questions that you have for me?
Nope.